Ever wondered why cardiac diagnostic tests are so important in modern medicine? It's because these tests are the cornerstone of detecting and monitoring heart diseases. We're going to explore 8 of these important tests in this video. 1. ECG 2, cardiac biomarkers 3, echocardiography 4, stress testing 5, nuclear cardiology 6, cardiac catheterization and angiography 7, contrast-enhanced CT coronary angiography and 8, magnetic resonance imaging, MRI. The heart, as we know, is a vital organ. Its steady rhythmic beat ensures life continues, but like any other organ, it can succumb to disease. Heart disease is a leading cause of death worldwide. It doesn't discriminate, affecting people across all ages, races, and socioeconomic backgrounds. Early detection and monitoring are key to combating this global health threat, and that's where cardiac diagnostic tests come in. These tests are our window into the complex workings of the heart. They give us a glimpse of the heart's structure and function, revealing any abnormalities or changes that could signal a problem. From the rhythm of your heartbeat to the flow of blood through your arteries, these tests capture it all. Now, you might be thinking, there must be a multitude of tests, right? And you'd be correct. But like everything in life, these tests are not perfect. Each has its own set of advantages and disadvantages. Some are quick, simple, and inexpensive, while others are more detailed and comprehensive, but may be more invasive or costly. The key is to understand these trade-offs to make informed decisions about your heart health. So, are you ready to delve into the fascinating world of these 8 crucial cardiac diagnostic tests? To peel back the layers of this complex vital organ and understand how we diagnose and monitor heart disease? Let's embark on this journey together as we strive to understand our hearts better and ensure they keep beating strong. Starting off our list is the electrocardiogram, commonly known as the ECG. This test is a vital tool in the medical field, primarily used to measure the electrical activity of the heart. But why is this important? Well, by tracking the heart's electrical activity, doctors can identify arrhythmias, ischemia, infarction, and other abnormalities. In other words, the ECG is like a window into the heart, providing doctors with valuable information about its function. Now let's talk about some of the advantages of an ECG. First and foremost, it's simple. An ECG is a straightforward test that can be carried out quickly, which is crucial when dealing with potential heart issues. Speed is of the essence, and the ECG delivers in this regard. It's also non-invasive, meaning there's no need for any surgical procedures. Plus, it's inexpensive and widely available, making it a go-to diagnostic tool in many healthcare settings. But like any other medical test, the ECG is not without its disadvantages. One of the main drawbacks is its low sensitivity and specificity for coronary artery disease, or CAD. This means that while ECGs are great at identifying many heart conditions, they're not as effective when it comes to CAD. It's also worth noting that the results can be affected by various factors, such as medications, electrolytes, and even body position. Therefore, while ECGs provide valuable information, they are just one piece of the puzzle in diagnosing heart conditions. To sum it up, ECGs are a vital tool in the medical field, offering a quick, simple, and non-invasive way to assess the heart's electrical activity. However, they are not foolproof and should be used in conjunction with other diagnostic tests to ensure a comprehensive understanding of a patient's heart health. So there you have it, the electrocardiogram, a crucial first step in diagnosing heart conditions. Next up are cardiac biomarkers. These are certain proteins or enzymes that can be measured in the blood. Now, why are we interested in these biomarkers, you might ask? Well, they become particularly important during or after a cardiac injury as they are released into the bloodstream. This release makes them sensitive and specific indicators of myocardial or heart muscle damage. Being able to measure these biomarkers is incredibly useful for both diagnosing and risk stratifying acute coronary syndrome, a term used to describe conditions associated with sudden, reduced blood flow to the heart. In addition to diagnosis and risk assessment, cardiac biomarkers also hold prognostic value for mortality and complications. This means that they can help predict the likelihood of death or complications in individuals who have suffered a cardiac injury. However, Like any diagnostic tool, cardiac biomarkers come with their own set of limitations. For instance, they are not particularly useful for screening or early detection of coronary artery disease, or CAD. This is because these biomarkers may only become elevated once damage to the heart muscle has already occurred. Furthermore, these markers may be elevated in conditions unrelated to the heart. For example, kidney disease, severe infections, or certain muscle injuries can also lead to increased levels of these biomarkers, potentially leading to false positive results. Lastly, the measurement of cardiac biomarkers requires blood sampling and laboratory analysis. This implies that results may not be immediately available and may depend on the capacity and efficiency of the laboratory involved. So, while cardiac biomarkers are a valuable tool in the diagnosis and risk stratification of acute coronary syndrome, they should always be interpreted within the context of the individual patient's clinical picture, including symptoms, medical history, and other diagnostic tests. To sum it up, cardiac biomarkers provide valuable information about cardiac injury. They are a crucial part of the puzzle in diagnosing and managing heart disease, but they are just one part of a larger, complex picture. Moving on to echocardiography. This is a fascinating diagnostic tool that utilizes ultrasound waves to create vivid images of the heart. The primary purpose of echocardiography is to assess the structure, function, and hemodynamics of the heart. It's like having a window into the heart's chambers, valves, and vessels, allowing us to witness the heart's rhythm and flow in real time. One of the key advantages of echocardiography is its non-invasive nature. No need for needles or incisions here. The ultrasound probe glides smoothly over the chest, capturing images as it goes along. And because there's no radiation involved, it's a safe choice for all patients, including those who are pregnant or have other health conditions. Another advantage is its affordability and accessibility. Echocardiography is relatively inexpensive compared to some other cardiac diagnostic tests, and it's widely available in hospitals and clinics around the world. Plus, it provides dynamic, real-time information about the heart. This means we can see the heart pumping, the valves opening and closing, and the blood flowing through the chambers right as it's happening. However, like any other tool, echocardiography has its limitations. One of the main disadvantages is that it's operator-dependent. This means the quality of the images and the interpretation of the data can vary depending on the skill and experience of the person performing the test. Another downside is that echocardiography can be limited by acoustic windows. In simple terms, this refers to the areas on the chest where the ultrasound waves can penetrate and bounce back to create clear images. If a patient has a large body habitus or lung disease, for example, it may be difficult to obtain high-quality images. Despite these challenges, echocardiography remains a vital tool in our cardiac diagnostic arsenal. It's a testament to the marvels of modern technology, allowing us to visualize the heart in ways we could only dream of in the past. Echocardiography allows us to visualize the heart in action. Now, let's talk about stress testing. This method of cardiac diagnostic testing is used to evaluate the heart's response to physical or pharmacologic stress. It is a non-invasive procedure that can reveal important functional and prognostic information about the heart. It works by increasing the workload on the heart, either through exercise or medication, and then monitoring the heart's response. Stress testing has a few key advantages. First, it's non-invasive, meaning it doesn't require any surgical procedures or incisions. It's also widely available, making it accessible for many people. One of the primary benefits of stress testing is that it provides functional information about the heart. It can reveal how well the heart is working and can help identify any areas that may not be receiving enough blood supply due to blockages in the arteries. In addition, stress testing can be combined with imaging modalities, such as echocardiography, nuclear cardiology, or MRI, to enhance its diagnostic accuracy. These combinations can provide a more comprehensive view of the heart's function and structure. However, stress testing also has its limitations. One of the main challenges is that it requires patient cooperation and adequate exercise capacity. This means that it may not be suitable for everyone, especially those with physical limitations or certain health conditions. Moreover, stress testing may yield false positive or false negative results. A false positive result indicates a problem when there isn't one, and a false negative result fails to detect a problem that does exist. Both scenarios can lead to unnecessary anxiety, further testing, or misdiagnoses. Lastly, stress testing may induce complications such as chest pain, hypotension, or even cardiac arrest, although these instances are rare. Therefore, patients are carefully monitored during the test to ensure their safety. In conclusion, stress testing is a valuable tool in cardiac diagnosis, providing functional and prognostic information about the heart. However, it's important to be aware of its limitations and potential risks. As with any medical procedure, it's crucial to discuss these factors with your healthcare provider to make an informed decision about your health. Stress tests show how the heart performs under pressure. And next we have nuclear cardiology. This is an exciting field that uses radioactive tracers to assess the heart's functioning. The purpose of nuclear cardiology is to examine myocardial perfusion, viability, and function at both rest and during stress. One of the significant advantages of nuclear cardiology is its high sensitivity and specificity for coronary artery disease, CAD for short. This means that it's highly effective at detecting and confirming the presence of CAD. It provides both quantitative and qualitative information, making it a comprehensive tool for diagnosing heart conditions. Moreover, it holds prognostic value for cardiac events, allowing doctors to predict the likelihood of future cardiac problems and plan treatment accordingly. However, every rose has its thorn, and nuclear cardiology is no exception. One of the significant downsides is the expense. The cost of the radioactive tracers and the technology required to read them can make this method a costly one. Therefore, it might not be the first choice for routine checkups or in settings where resources are limited. Another disadvantage of nuclear cardiology is that it requires radiation exposure. While the levels are typically low and considered safe for the patient, any form of radiation exposure can carry potential risks, especially if the patient requires multiple tests over time. Additionally, this method may have artifacts or attenuation which can potentially interfere with the results. Lastly, it requires adequate tracer uptake and clearance, meaning it might not be suitable for all patients, particularly those with certain health conditions that could affect the uptake or clearance of the tracers. In conclusion, nuclear cardiology is a powerful tool in the diagnosis and management of heart conditions, particularly CAD. It offers in-depth insights into the heart's functioning, providing valuable information that can help guide treatment decisions. However, it's essential to be aware of its limitations and potential risks, such as cost, radiation exposure, and the potential for artifacts or attenuation. Nuclear cardiology provides in-depth insights into the heart's functioning. Up next is cardiac catheterization and angiography. Cardiac catheterization and angiography is a more invasive diagnostic test utilized when other non-invasive tests perhaps don't provide as clear a picture as desired. The purpose of this procedure is to get a detailed visualization of the coronary arteries and heart chambers. It allows medical professionals to accurately measure pressures and flows within the heart. To perform this procedure, a thin, flexible tube known as a catheter is inserted into an artery or vein, typically in the groin, neck, or arm, and carefully guided up into the heart. Once in position, a contrast agent is injected through the catheter to make the heart structures visible under X-ray imaging. This process gives doctors a real-time, moving image of the heart and its blood vessels. The significant advantage of cardiac catheterization and angiography is its high spatial and temporal resolution. This means that it provides incredibly detailed, high-quality images of the heart's anatomy, allowing for precise diagnoses and treatment plans. It can reveal blockages or narrowing in the coronary arteries, detect heart defects, and measure the heart's pumping function. However, like all medical procedures, it comes with its own set of limitations. Being an invasive procedure, it carries potential risks such as bleeding, infection, or damage to the arteries. There's also a small risk of complications linked to the contrast agent, such as allergic reactions or kidney problems. And of course, as with any medical intervention, there's always the potential for unforeseen complications. It's also important to note that cardiac catheterization and angiography is typically more expensive and time-consuming than non-invasive cardiac tests. Therefore, it's often reserved for situations where other tests have not provided sufficient information or when immediate intervention may be necessary. Despite its invasive nature, cardiac catheterization and angiography provide crucial information about the heart's anatomy. This in-depth knowledge can guide treatment decisions, making it an invaluable tool in the fight against heart disease. Lastly, we have the magnetic resonance imaging, or MRI. This diagnostic tool is used to create detailed images of the heart and surrounding structures. It employs a powerful magnetic field and radio waves to produce high-resolution images, which can reveal details that other diagnostic tests may miss. MRI is non-invasive and does not expose patients to ionizing radiation, making it a safer alternative to certain other tests. It can visualize the heart in multiple planes and dimensions, providing comprehensive information about its structure and function. However, it's not all sunshine and roses. MRI's main drawback is its cost, as it tends to be more expensive than other imaging tests. Additionally, it cannot be used in patients with certain implants such as pacemakers or certain types of clips or stents due to the magnetic field. Despite these limitations, MRI provides detailed images of the heart and is a powerful tool in diagnosing heart conditions. Now that we've gone through each of the 7 crucial cardiac diagnostic tests, let's summarize. We started with the ECG, a simple, quick, and inexpensive test that measures the heart's electrical activity. Though it's not highly sensitive or specific for coronary artery disease, it's a valuable tool for detecting arrhythmias, ischemia, infarction, and other abnormalities. We then moved on to cardiac biomarkers, which measure the levels of certain proteins or enzymes in the blood. These are especially useful for diagnosing and assessing the risk of acute coronary syndrome. While not ideal for early detection, they offer valuable prognostic information. Echocardiography uses ultrasound waves to create images of the heart, assessing its structure and function. It's non-invasive, readily available, and can be enhanced with stress or contrast agents. However, it's operator-dependent and can underestimate the extent of ischemia. Stress testing evaluates the cardiac response to physical or pharmacologic stress. It provides functional and prognostic information, but requires patient cooperation and can produce false results. Nuclear cardiology uses radioactive tracers to assess myocardial perfusion, viability, and function. It offers high sensitivity and specificity for coronary artery disease, but it's expensive and requires radiation exposure. Cardiac catheterization and angiography involve inserting a catheter into the heart to visualize the anatomy and measure pressures and flows. Though invasive, it offers high spatial and temporal resolution. Finally, we discussed MRI, a non-invasive imaging technique that provides detailed images of the heart's structure and function. It's especially useful for evaluating the heart's chambers and valves, as well as detecting and assessing damage from heart diseases. Each of these tests has its own advantages and drawbacks, but together, they offer a comprehensive toolkit for diagnosing and managing a wide range of cardiac conditions. Knowing these tests and what they entail can help medical professionals make informed decisions and provide the best care for their patients. Thanks for watching, and don't forget to subscribe and give a thumbs up if you found this video helpful.